Can traumatic grief lead to substance abuse? Have you ever wondered how deep emotional pain can affect our choices? Traumatic grief can indeed lead to substance abuse, and the connection between these two is intricate. When someone experiences the loss of a significant person, especially in a traumatic way, it can create intense emotional distress. This distress can make individuals more vulnerable to misusing substances as a way to cope with overwhelming feelings like sadness and anxiety. Research indicates that those dealing with complicated grief are at a higher risk for developing substance use disorders. This means that the emotional turmoil from grief can lead some to turn to alcohol or drugs to numb their pain. Conversely, individuals who struggle with substance misuse often find themselves facing complicated grief symptoms after a loss. This creates a cycle where grief and substance abuse worsen each other. For instance, increased substance use before or after a loss can intensify grief symptoms, while complicated grief can lead to higher rates of alcohol dependence and smoking. Several factors contribute to this relationship. First, coping strategies play a crucial role. People with substance use disorders may rely on less effective coping mechanisms, such as turning to substances for emotional relief or withdrawing socially. These behaviors can worsen the symptoms of complicated grief. The type of loss also matters. Traumatic or sudden deaths are linked to higher rates of substance use among those grieving. Such losses can be harder to process, leading to more severe reactions. Additionally, age and developmental stage are important. Bereaved children and adolescents, particularly those who lose parents or face multiple losses, show a greater risk for later substance misuse. Psychological symptoms like grief-related depression and anxiety often occur alongside substance use, complicating recovery efforts and increasing risk. From the perspective of post-traumatic stress disorder, traumatic grief shares features with trauma-related disorders. Individuals may experience intrusive memories, emotional numbness, and avoidance behaviors. In these cases, substance use may be an attempt to self-medicate these distressing symptoms. However, this self-medication can interfere with the natural grieving process and worsen mental health outcomes. It's essential to recognize the importance of assessing grief symptoms in individuals with substance use disorders. Integrated treatment approaches that address both grief and addiction can be beneficial. Effective grief interventions can help reduce symptoms of complicated grief and substance misuse simultaneously, leading to better recovery outcomes. In summary, traumatic grief can lead to substance abuse, especially when the grief becomes complicated or prolonged. The relationship between grief and substance use is significant and requires careful attention to improve emotional well-being. Seeking professional medical care and evidence-based treatments is crucial for addressing these intertwined challenges.